Good day. My name is Andy Hagler, and I am the Executive Director of the Mental Health Association in Forsyth County. And thank you very much for giving me the opportunity to talk a little bit about our agency, the Mental Health Association in Forsyth County, a little bit about our programs and services. And then towards the end of my talk, I'm going to share some coping strategies and some ways to help enhance your resiliency during the COVID-19 pandemic. The Mental Health Association of Forsyth County, we are a local nonprofit, non-governmental agency, and we've actually have been in Forsyth County since 1946. We are located on Hawthorne Road. Our address is 1509 South Hawthorne Road. We're right here on the corner of Hawthorne and Knollwood. We're in a house right next to the Food Line grocery store on Hawthorne Road. And our focus in the mental health arena is that we're here to provide advocacy, support services, outreach, and community education services. So when you think about the Mental Health Association of Forsyth County, we provide an array of non-clinical mental health services. And when I talk about non-clinical, again, that's providing those supportive type services. Clinical services would be things like medication management, or therapy. But again, we're kind of more on the non-clinical side. Some of our programs and services that we run here include support groups. And again, the operative word is support. And during the pandemic, we offer an array of client support groups. In fact, we offer 4 support group meetings each week. We have a support group for young adults. For young adults ages 18 to 30 or thereabouts. It's called Thrive. We have a support group for adults with mood disorders that consist of major depression, bipolar disorder, and other mood disorders. We have an online support group for adults with anxiety disorders. That would include things like generalized anxiety disorder, panic disorder, social anxiety, post-traumatic stress disorder. And then we have a Friday morning group, and I kind of call this our Friday morning sort of catch-all group. And that group meets on Fridays from 10:30 to noon. And our other groups meet in the evenings from 7 to 8:30. And all you have to do is call our office at 336-768-3880, 336-768-3880, and you can call and inquire about our support groups online. And they are free, they are led by trained facilitators, and again, the operative word is providing that support. We also provide information and referrals and access to services, and that is done by helping people access services in the community. So it may be somebody calling or sending an email, and they are looking for a therapist, or they are looking for a psychiatrist who is a medical doctor to prescribe medication, to provide medication and medication management. Or it may be someone who's calling to look for substance use services, or maybe somebody that's calling to look for family support. Again, we provide information and referrals, but it's more than just lip service. It's more than just spouting out information or referrals, because we actually follow up with the caller or the person who walks in the office or the person who sends an email inquiry. We actually follow up to see if they did access that service. And it doesn't matter whether the person has insurance like Blue Cross Blue Shield, we serve those individuals, or if the person has Medicaid, or if the person has Medicare, or even if the person is uninsured, we can help direct people based on their mental health needs and also based on the resources they have or they may not have to help them access services. And again, we follow up to document to see who actually did access services. We also provide an array of educational trainings. I tend to call them Mental Health 101 trainings that can be done to groups, to church groups, for pastors, for civic groups, for anybody really interested in learning about mental health and mental illness. And the value of these community education or Mental Health 101 is that they help to educate the community that mental illness is real, that mental illness is very common because mental illness affects 1 in 5 children, 1 in 5 men, 1 in 5 women, 1 in 5 older adults, middle-aged adults. Mental illness affects about 20% of the population. And about half of that 20% have what we call serious mental disorders, such as major depression, bipolar disorder, schizoaffective disorder, schizophrenia, and so forth. And did you also know that about half of all your mental disorders begin by age 14? Half of all mental disorders begin by age 14. 3/4 of your mental disorders begin by age 25. So we really need to start looking at mental health and mental illness, not only as an illness of the brain, but also as a childhood disorder, because most of your mental disorders begin in childhood. Half by age 14, 3/4 by age 25. And again, knowing that and the education is one way to help reduce the stigma, because people with mental illness are still very much stigmatized in our society in terms of employment, in terms of housing, in terms of jobs, and in terms of a lot of different things. We also provide another training that's called Crisis Intervention Team. Again, that's called Crisis Intervention Team, or sometimes known as CIT. And you can actually Google Crisis Intervention Team and get a little bit more information about that. But in a nutshell, the Crisis Intervention Team trainings are a 40-hour training that's geared for first responders. So again, for our law enforcement, such as the Winston-Salem Police Department, Forsyth County Sheriff's Office, Kernersville Police Department, our campus police at Forsyth Tech, at Winston-Salem State University, School of the Arts, Wake Forest, our security officers at hospitals, also our probation and parole officers, because they're considered first responders, as well as EMS. This is a training for our first responders to help them better gain an understanding about the complexities surrounding mental illness. This training also exposes our trainees to resources in the community that work with those with mental health issues, substance abuse issues, as well as intellectual and developmental disability issues. And furthermore, this training is geared to help our first responders better identify individuals who are in a mental health crisis. And it works to help, and it gives them the skills to help them de-escalate that individual in crisis, and then to get help for that individual in crisis, as opposed to handcuffing the individual and putting them in jail. We've been providing the Crisis Intervention Team trainings here in Forsyth County since 2007, and we will resume those trainings in the very, very near future. But again, you can learn more about that by Googling Crisis Intervention Team. And the Mental Health Association is the lead agency here in Forsyth County for those trainings. We also provide online screenings through our website. Our website is www.triadmentalhealth.org. And you can click on screenings, and we offer 7 different screening tools that anybody in the community, anywhere, can partake. We have screenings on depression, bipolar, on alcohol, PTSD, and so forth. And so we offer these educational tools. Screenings are not a diagnosis, but the value of the screenings is that they help individual gain information that perhaps they may or may not, but that they may have symptoms associated with depression, or perhaps symptoms associated with bipolar disorder or with post-traumatic stress disorder and so forth. So again, screenings are an educational tool. And at the end of each screening, there are some questions that people can answer. The screenings are anonymous, so we do not ask for a name or address or phone number or anything like that. And then the results of the screening tool pops up, and then it gives further instructions on what to do, to how to access services or take that further. So again, our educational screening tools, and that's available on our website, which is triadmentalhealth.org. And then we're also involved in the community in a variety of ways, through mental health treatment court, through Veterans Mental Health Treatment Court, and then like today through agency fairs and community events through all of our different partners here in the community. And then we also provide advocacy services for individuals or for maybe their families, again, to help advocate for those who have mental illness and maybe speak out and speak up for those who may not be able to speak for themselves. So this kind of gives you an array of a little bit of the programs and the services that we provide. And again, you can log onto our website, again, which is triadmentalhealth.org, and read and learn more about the array of the non-clinical services that we provide here at the Mental Health Association. A lot of times people come to us sort of as that first portal. Sometimes people will say, I think I need to see a therapist, but I just don't know what to do. And again, we can help that person. Or sometimes the caller or walk-in may be a family member. And what can I do to try to help my loved one get the help that they need? And again, it may be, say, a pastor of a church that's like, I would like for you to come and do a training to our staff, because we have individuals who are members of our church who have mental health issues, or to help us better learn about mental health. So again, these are some things that we're here for, as well as our online support groups. And again, for more information, you can always call us at 336-768-3880. I also just want to take a few minutes and share with you about just some general coping skills, some building resiliency during this pandemic. A year ago, if somebody told me that I'm going to be making videos and sending them out, I wouldn't have believed you. But the pandemic has changed a lot of our behaviors. Like I said, our support groups that we offer are online. And a lot of what we provide now is still online. And of course, here I am doing a video about our programs and services and talking about coping strategies. Our behaviors have changed. Words such as social distancing has come into our vocabulary. Wearing a mask. I know some people, don't like wearing a mask, but wearing a mask does help, and it can help as far as slowing the spread. And also just sanitizing, washing your hands, and again, just being aware that COVID-19 or the coronavirus is highly contagious. And for some people, they may only have very mild effects. But unfortunately, we've also known that some people, it can be very devastating. And very sadly, and in North Carolina and in our country, where people have died due to coronavirus. So all of this is just to help keep people safe. But nevertheless, it's called for a lot of changes in our lifestyle, a lot of changes in the way we used to do things. And as human beings, we don't like change. We really don't like to change things a whole lot. And along with that, and along with the changes, there's the anxiety, there can be the depression, there can be a lot of thoughts that's going on out there, again, because of the pandemic. Think about it. We're more isolated. We're not out socializing as much. And for some people that may have feelings of depression or anxiety, this further isolation, this further having to stay home more, can sometimes exacerbate those feelings and sometimes can make things worse. So here are just some very simple, practical, everyday coping tips for helping all of us build resiliency. And when I say the word resiliency, it's just a fancy word for bouncing back through sometimes the challenges that we all go through and that we're all going through during this pandemic. And one thing, of course, that we all need to do, and let me also just make it very clear that when I say things that we all need to do, I'm talking to myself as well. I'm not a saint, I'm not perfect. So these are things that we all need to do a little bit better, including myself. Number one, it's making sure that you get enough rest and enough sleep. And I know the standard rule is always somewhere around 7 hours, maybe 8 hours, but at least try to get 7 hours of sleep. And sleep actually helps to build up our immune system. It resets our biological clocks, and so it helps us to fight off those illnesses and it gives us that strength or whatever to build up our immune system. Sleep is also a great stress reducer. If you've ever heard of the phrase, "let me sleep on it," there's actually truth to that. And there's actually studies that validate that sometimes getting good, restful sleep can help you, especially when you're dealing with life issues or maybe really having to make some decisions. Again, it can help reset and strengthen your thought processes so that you're able to make decisions based on facts and based on information rather than just solely based on emotion. So get some sleep. It really does your body good, and it also does your mind some good. Sometimes it's called just resting your mind. The other thing is when you're preparing for sleep, turn off your phone. Turn off your tablet. Turn off your laptop. Turn off your desktop. Turn off all of your electronic devices. We know that the light that emits from a lot of our devices is very similar to the light that emits from the sun, which actually then increases the serotonin level in our brain, which then actually keeps us awake. Serotonin helps keep us awake or helps keep us alert. So really for about an hour or maybe an hour and a half, and you kind of test it and be the judge, turn off the phone. Turn off your laptop. Turn off your tablet. Stop checking your email. Stop going on social media. Because again, that light can be detrimental to us and prevents us from getting a restful sleep. So turn off the phone. Turn it off. The other thing is maybe before you go to bed, sometimes take some time and practice what we call gratitude. What are some things that you are grateful for? What are some of the things that you are very thankful for? Practice gratitude and take some time every night, or if it's better for you in the morning when you wake up, what are those things that you're grateful for? Is it for good health? Is it for access to education? Is it for, I've got transportation, I've got a home or an apartment, grateful that my basic needs are met? What are the things that you're grateful for? Grateful for family, grateful for a significant other, grateful for supportive friends. It doesn't matter how large or how small or how grand or not so grand. Think of all the things that you are grateful, because what that does is that helps us steer our thought processes into something more positive. And again, it kind of changes the way our nervous system, the way our blood, the way our circuitry in our brain just kind of flows. And it helps us to relax. It helps us to de-stress, because again, we're focusing on the things that we're grateful for, not focusing on the things that we don't have. So again, practice gratefulness. And again, this isn't rocket science, but all of these things are intentional and things that you have to do. Also, the other thing is just make sure to drink plenty of water. Drink plenty of water. Our organs, our lungs, our brain, and parts of our body are made up primarily of water. And before you have that first cup of coffee in the morning, drink some water. Because when we wake up in the morning, after hopefully a very restful night's sleep, a lot of times we may be already dehydrated. So drink a glass of water before you have that first cup of coffee. And then during the day, drink water. Not iced tea, not Coke, not Diet Coke or Pepsi or whatever, or not drink coffee all day, but drink water. Our body will really benefit from that. And drinking water has a lot of great health benefits to it. So drink plenty of water. The other thing is, when was the last time that you maybe have read a book just for pleasure, or spent a half hour reading a book or reading a magazine, or maybe learning about something that you didn't know, maybe reading about another culture or maybe another religion, or a topic, science fiction or a murder mystery or whatever, that you've never read before. So again, practice some time when you can to read, but to read for pleasure, and maybe learn something or read a different subject matter that you've never read before. Again, we're creatures of habit. So if you like history, I like a lot of history and reading about architecture. So, of course, those are things that I'm going to gravitate to. But it's intentional, where then you may need to go to the fiction, or maybe to science fiction, or maybe since I am a homeowner, I go to a lot of home repair how-to section in a bookstore or library or online, again, to make home repairs. So again, taking that time to learn something new, because again, it helps to stimulate your brain, stimulate your thought process, and again, doing something new and learning. Again, we're creatures of habit, and again, these are just some intentional things. The other thing that I like to tell people is to stay in touch with your spirituality. You know, before the events of September 11th, 2001, a lot of times us in the mental health profession, we would not have talked about spirituality. And when I say spirituality, it doesn't necessarily mean religion. It can be religion, but again, in whatever way, shape, or form that is for you, is to stay in touch with your spirituality. Because we have now found, and studies have shown, that people who are more spiritually aware, people that sometimes may turn things over to a higher power, or to whatever way, shape, or form, tend to be a little less stressful, tend to be a little less depressed, and tend to have a more positive outlook on life. So again, stay in touch with your spirituality in whatever way, shape, or form that might can be. And as we talk a little bit about that, this also leads into learning to take things one day at a time. You know, with this pandemic, we've been through a lot of changes, and we don't know what the future is going to bring. And we really don't know quote unquote, when things are going to get back to normal. And people ask me that all the time, and I don't know. But what we can do is really try to work to take things one day at a time, or maybe for some people it might be 1 second at a time, or even 1 hour at a time. Al-Anon, if any of you are familiar with Al-Anon, one of their sayings is to take things one day at a time. The other thing to help you to cope and to build some resiliency and to help with all the different changes and just stressors is to really examine those things that are out of your control versus the things that are more in your control. And are you letting maybe the things that are out of your control stress you out more because there's nothing you can do about it? For example, like with the coronavirus, there are some things that we can do about it. There are some things that are in our control, such as wearing a mask and social distancing and hygiene, washing your hands, and so forth. But there are also some aspects that are a little bit out of our control. For right now, we're in phase 2.5. There are things that we have to adhere to in order to minimize the spread. But then there are also some things that may be out of our control. So learn to think about and examine those things that are out of our control. And maybe sometimes the best thing to do is to accept it. Just accept that these are situations or times that are out of our control, and there's really nothing that I can do about it. And sometimes the best thing to do is to try to accept it. But at the same time, think about those things that are more in your control and those things that you can change, and then work towards changing it. In AA, since I mentioned Al-Anon a little earlier, I'll mention AA. In AA, there is, at the very beginning of each meeting, there's a saying that they have, which is to grant me the serenity to accept the things I cannot change. To grant me the serenity to accept the things I cannot change. To have the courage to change the things that I can. To have the courage to change the things that I can, and the wisdom to know the difference. So again, prioritize those things that you can't change, and maybe sometimes you just have to learn to accept it, but then think about those things that you can change and can work on. And then finally, as I'm ending today, and again, these are just some examples, but finally, make sure above all else, if there's nothing else that you do or any advice that you take from me, it's to stay connected with people who support you. Stay connected with people who support you. That is probably one of the best things that you can do for your physical health as well as for your mental health. During this time, is vital either through Zoom or Teams or WebEx or whatever, but to stay in touch with your friends, with your family, and the people who love you. And not only the people who love you, but the people who support you. We as human beings are social creatures. We're not made to live isolated lives. And so it's very, very, very important for our physical health as well as for our mental health is to stay connected and to be with those who love you and to be with those who support you. These are just kind of a few coping techniques and some ways to build resiliency. There are many, many, many more, but just for the sake of time, I just wanted to throw these things out. And as you notice, they're all pretty simple, and a lot of it's common sense, which is true. It's common sense. But to work towards building coping strategies and building your resiliency, it's also intentional. These are things that you have to do. They're not going to come to you. These are things that you have to work at. So I ask that you maybe try one or two of these things, or there may be something else that you might want to try. For example, I didn't even mention about exercise or just being outside and enjoying nature. Find what helps you in a healthy way to de-stress and to cope with all the changes and to give your mind and your body some time to de-stress. You'll live longer, your brain will function a lot healthier, and your outlook on life will, for the most part, will always look towards the more positive rather than the more negative side of things. I just want to thank you for this opportunity to share a little bit about the Mental Health Association and who we are and our programs and services. Again, my name is Andy Hagler. I'm the Executive Director. I've been here for 23 years. Again, we're located at 1509 South Hawthorne Road in Winston-Salem. Our phone number is 336-768-3880. So feel free to call, to go on our website, which again is triadmentalhealth.org, triadmentalhealth.org, or feel free to shoot me an email, which is Andy, A-N-D-Y, Andy at triadmentalhealth.org, Andy at triadmentalhealth.org. Again, thank you for this opportunity to speak and to share. Stay healthy, keep yourself healthy, and stay safe. Stay safe for yourself and stay safe for those who love you. Thank you. Take care.